So I got sickle cell disease. This is just a little thing that I made with just the basics. So sickle cell disease is a condition where the red blood cells sickle and clot in tiny capillaries of the body. The sickle cell looks like if it was twisted and bent, is more rigid than a normal red blood cell. It resembles a C shape or a banana shape. When these sickle cells get stuck in the capillaries, the blood stops moving through the vessels and can cause damage to the cells and tissues and organs. This disease causes physical weakness and damage to the brain, heart, and spleen, and is commonly fatal around 60 years of age. Blocked blood flow and organ damages raise the risk of infection. Although the pain is somewhat treatable, the factors are more difficult to control. There's always the risk of complications such as hand and foot syndrome, splenic crisis, infections, sickle crisis, pulmonary hypertension, and more. So this is what a normal red blood cell looks like, and this is what a sickle cell looks like. So people who carry the trait are able to have sickle cell crisis if conditions are extreme. The reason for these sickled cells are because the hemoglobin in the red blood cells crystallize and become misshapen. If a person is not in the appropriate condition for this disease, the individual may experience chronic pain, shortness of breath, headaches, coldness in the hand and feet, and paler than normal skin. A lot of times, doctors prescribe hydroxyurea. This is the only medication available that reduces pain and in this disease, but it can also reduce the white blood cells and raise the risk of infection. So why this happens. Mutations in the HBB gene cause sickle cell. This condition is inherited in an autosomal recessive pattern, which means both copies of the gene in each cell has a mutation. Usually you have to get it from both your mother and your father. So sickle cell is most common in the African region of the world. 1 out of every 500 African Americans inherit sickle cell, but it doesn't just affect African Americans. It's most common in them, but it's also present in other racial populations. About 1 in 1,200 Hispanic Americans also have sickle cell. People who inherit sickle cell hemoglobin gene and a normal gene still have the sickle cell trait, and these carriers can pass their gene on to their children and so on. So sickle cell depends on the nature of a gene's protein product and its role in the cell. A few other things that I would mention to my patient would be that sickle cell is one of the most common genetic blood disorders. It affects about 100,000 people in the United States. I would also add that there are special blood tests that you can use to confirm whether or not you have sickle cell the trait or the disease. One is hemoglobin electrophoresis, and then a routine CBC can also tell if you have sickle cell. It will show that your hemoglobin is low, which basically means you have an anemia. You can also get blood transfusions with sickle cell. They can transfuse compatible red blood cells from a matched donor who doesn't need to have sickle cell disease as well. And that's it.